Hi friends, I am Dr. Pratap Singh Rathod. I have done an MD in forensic medicine, and today we'll discuss about adipocere formation, which is the late change which is seen after death. Adipocere is a word derived from adipose, which means soft fat, and cera, which means wax. So adipocere formation is a modified process of putrefaction, wherein the fatty tissues of the body change into substance known as adipocere by hydrolysis and hydrogenation of fatty tissue. This is the image of adipocere where you can see the body is converted into a waxy tissue after few days. Mechanism of adipocere formation. In this, there is a postmortem hydrolysis and hydrogenation of body fats. So body fats which are present in the body in the cheeks, buttocks area are converted into fatty acids, mainly like stearic acid, palmitic acid, oleic acid, octadecanoic acids. These acids may combine with calcium and ammonium to form some insoluble soaps and wax. Normal fatty acid content in the body is around 4.5%, but in adipocere formation, it increases to 20% at the end of 1 month and to 70% up to 3 months. 70% of the body is covered into fatty acids. So one more example of image of adipocere, we can see the waxy tissue coming out of the body. Essential requirement is mainly the absence of air environment. There should not be air should be absent. There should be excess of moisture and there should be some warmth in the environment. Commencement, it starts in the subcutaneous fat, mainly in the cheeks, female breasts, abdomen area and buttocks where fatty tissues is deposited in large quantity. Later on, internal viscera and muscles also change into adipocere. Characteristics of adipocere. Body is covered into soft yellowish waxy fat and which are brittle substance, which is brittle. It floats on water since it is a wax and mainly it is a oil. It floats on the water. It can be cut easily. That it is adipocere. It melts on heating. It burns with faint yellow flame. So if we take the adipocere and if we try to burn, it burns as a faint yellowish flame. It dissolves in alcohol and ether since it is organic material. It dissolves in alcohol and ether. Body emits sweetish disagreeable smell. In early stages, it has a ammoniacal smell. Later on, it becomes a disagreeable sweetish smell. In this, facial features and injuries of the body are well preserved since body is completely covered in fatty tissue and body doesn't go into putrefaction. The body tissue face features are preserved. Because of that, identification of dead body is possible. Facial features is possible present, so identification is possible. And cause of death can also be known if the person had died because of some injuries. If death due to injuries is there, then cause of death can be known. Time required for adipocere formation. Adipocere formation does not occur in fetus less than 7 months since their fatty tissue is not present. Adipocere is well marked in fatty bodies if the body is in water. Normally, adipocere formation takes occurs in less than 3 days, from 3 days to 3 months. So in between 3 days to 3 months, it will completely formed. Once formed, adipocere preserves the body for many decades. Factors influencing adipocere formation. If you consider age, as I mentioned, in fetuses less than 7 months, adipocere doesn't occur. In built, obese people and mature newborns, it is formed very quickly since fatty tissue is more than. Environmental temperature. Heat accelerates and cold retards the adipocere formation. Moisture. It occurs rapidly in bodies submerged in water than in damp soil. Air current. It retards adipocere formation by operation of the body fluids and reducing the body temperature. So air current is not beneficial for adipocere formation. Running water. Adipocere formation retarded as the electrolytes are washed away from the surface. Bacterial infection. Early activity of anaerobes like Clostridium perfringens assist in reaction as bacteria produces lecithinase enzyme which facilitate hydrolysis and hydrogenation. Next is medical importance of adipocere. It is a surest sign of death since the facial features are preserved. Identification of the death can be known. Cause of death can be also known if in case the death is due to injuries since the facial features and body features are intact. Time since death can be known roughly based on how much the adipocere is formed. These are my references. Thank you.